If your infant has a red or goopy eye, it's always best to talk with a pediatrician because after performing an exam and asking you more specific questions, they'll make a diagnosis and determine if intervention is necessary. There's a few different things that the doctor will consider, and it largely depends on the baby's age and the severity of the symptoms. For example, if a brand new baby starts to have signs of infection, then we worry about infections that they could have caught coming through the birth canal. For this reason, babies are all given an antibiotic eye ointment shortly after delivery to help prevent these types of infections, which ultimately can lead to blindness. In most cases, though, babies who have a red goopy eye either have an eye infection, also known as pink eye, or sometimes have clogged tear ducts. Eye infections can be caused by either bacteria or viruses, and viruses can't really be treated. They just need to run their course, and it can last up to 7 to 10 days. But bacterial infections can be treated with certain antibiotic drops, and the pediatrician will determine if this is appropriate treatment for your child after performing an exam. Another thing a pediatrician will consider is a clogged tear duct. About 5% of babies are born with this, and it can cause drainage from the eye. In some cases, it needs to be treated with antibiotics, but in other cases, it doesn't, and the clogged tear duct usually resolves on its own. Occasionally, pediatricians will recommend eye massage, and this helps to pop the tear duct open. And in a small number of cases, a minor procedure needs to be done when the child gets older if it hasn't resolved spontaneously. If your child has eye drainage, you're probably wanting to clean it, but you need to be super careful because it's highly contagious if it's due to an infection. And if it's only in one eye, you could accidentally spread it to the other eye, or you could catch it and it could also spread to other children that you might have in the home. So if you're going to clean your child's eye, get a clean washcloth, get it wet with warm water, and start on one eye and just gently wipe from the inside of the eye to the outside. And if you're needing to wipe the other eye, get an entirely different cloth and then wipe the other eye. That's just the safest way to prevent the transfer of infection from one eye to the other. Also, try to do what you can to get your child to not touch their eye because, of course, again, if they do that and then touch their other eye, they will infect it too. If you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms and recommend us to your friends and family too.